He just turned a year yesterday, and I brought him in for his well checkup.
Crystal Peña has been bringing her family of 6 to El Centro de Corazon health clinics for many years. Faced with the dilemma of not having health care insurance, she found out about the low-cost clinic through her aunt and hasn't stopped coming back.
I was taking him to a regular doctor, and I had to make an appointment, and it would take months for them to see him. And here I just brought him in 3 months ago, and right away they seen him that same day.
El Centro de Corazon was established in 1994 as a community-based social service organization for East End families. Their initial focus was early childhood development. Now they offer primary, prenatal, dental, and mental health care services.
The East End has historically been a Hispanic community, and it's been a community in many ways that's been overlooked as far as services go. Healthcare being one of those. El Centro has really been driven by the needs of the community.
In October 2003, El Centro merged with the well-established Eastwood Health Clinic. Eastwood had been providing primary care to the East End since 1983. So that merger helped bridge a huge healthcare gap in the community and streamlined low-cost medical services for its residents.
Some of them live in neighborhoods which are not very safe. The accessibility, I mean, we're here, we're very open to walk-in patients. We try to accommodate anybody that comes in the door. We really try not to turn anyone away.
I believe if we weren't here, then there would be, nobody would be able to have any kind of services at all.
When patients arrive at one of the clinics, they are treated to quality healthcare professionals. But these staff members are not strangers to the community.
I would consider our family underserved, and we actually use a lot of clinics that provided discounts or were free because my parents couldn't afford, medical insurance for their kids. Over the years, I've realized how important clinics like these are to provide, health care and health maintenance to those people who really can't afford, private insurance.
They make sure that I'm very well taken care of.
Blanca Cruz has been receiving prenatal and postpartum care at El Centro's Magnolia Clinic for over 2 years. She returns not only for the excellent medical care her growing family receives, but also for the clinic's warm neighborhood atmosphere.
It's very friendly. Everyone asks how you're doing, and they pretty much know you, and so that's what I like about them.
El Centro needs to adapt in order to keep up with the needs of an ever-changing community. They take advantage of opportunities to grow into existing spaces as well as acquire new ones. The new pediatric clinic on Canal Street gives El Centro a wider reach into the community. But adapting comes at a high price tag, so their main challenge is to balance the clinic's fiscal needs with the physical needs of the members it serves.
El Centro, at this point in its history, is a testament to the fact that if the larger community comes together to back an agency, that it's endless.
The additional room translates to expanded services for the community. An ultrasound machine provided by the city means the clinic no longer has to refer its patients to facilities many miles away for ultrasound services.
Sometimes a patient who maybe we thought was having a miscarriage, we would have to send her into the hospital. She may wait 4, 5, 6 hours to be seen at all, sitting in a chair, uncomfortable. Now we can bring her in, do an ultrasound, find out, are things good, is there a problem, and we can tell her right then what we're thinking is going on.
But additional space and services are always needed.
I think it'd be wonderful if we had room and space for a non-stress test, a fetal monitor, so that we could do our own non-stress test. That again would keep us from sending patients to the hospital for something that we could do ourselves in the clinic.
El Centro de Corazon's mission is simple: to promote the individual, community, and social health of the East End and the greater Houston area.
It is a proud community, and it's a generous community, it's a loving community, and it's a sick community.
I've absorbed a lot of patients into the practice who have multiple medical needs.
The majority of our patients are not coming in early. They're coming in after their chronic diseases are already advanced. And I think it's mainly because they can't afford health care and have their annual physicals to screen for those diseases early and catch it early.
Word of mouth and news stories have spread the El Centro message. Families from all over the Houston area, as far away as Katy and Humble, have driven to the East Side medical sanctuaries for checkups. So with that growing demand comes a need for more services. With greater help, El Centro can offer more families the basic health care we sometimes take for granted. Low-cost, basic health care, which not only maintains a healthy community, it helps a community thrive.
And I've been very blessed to be able to do this. Certainly responding to the needs of this community has been the focus of my life for the last 30 years. So I'm lucky.
And it's very rewarding. I mean, I've seen babies since they were 2 weeks old. They're going to turn 4 this June, July. I mean, I've seen them grow. I mean, every time, some of them now come back once a year, and I'm like, oh my God,
That I have much more interaction with my patients here. I get to know them a lot more than I would have in the medical center, and it's definitely fulfilling. The patients are very appreciative here.
It's like more of a family-oriented type of organization than it is a job or a work, because you just come to know the families more on a one-on-one personal level than just seeing them as people.
They bring their moms, they bring their sisters, their cousins, their friends to see us because they know us and they know that we care about them.
I'm grateful for, what they've done for me.
They tell me thank you from the minute I walk in to the minute I walk out. And they're just sincerely really appreciative of what we're doing for them.
It means a lot. There's a lot of other places, but you would have to be waiting in long lines. I'm really thankful.